Okay, so what if one of the most common medicines on the planet, a pill millions of us take every single day for cholesterol, what if it had this incredible hidden power, a life-saving secret? Well, that's exactly what we're going to dig into.
So let's just ask the big question right up front. Could that humble little cholesterol pill be doing more than just helping our hearts? Could it actually be a powerful weapon in the fight against cancer? It sounds pretty wild, but stick with me.
All right, so quick refresher, just so we're all on the same page. What are statins? They're simply a type of drug prescribed all the time to lower your cholesterol. That's their main job. But as you're about to see, their side hustles might be even more incredible.
Now, we're not just talking about one or two little studies here. We're about to look at some huge, overwhelming data that all points to this amazing connection between taking statins and getting better cancer outcomes.
The sheer scale of this is honestly staggering. A massive 2024 meta-analysis, which is like a study of a bunch of other studies, looked at data from almost 400,000 people. And what did they find? They saw lower rates of cancer in statin users across 21 different types of cancer. Not one or two, 21. That's a huge deal.
And when you zoom in on specific cancers, the numbers are just jaw-dropping. For guys with advanced prostate cancer, you're seeing about a 27% lower death rate. For triple-negative breast cancer, which is notoriously aggressive, some studies show up to a 75% lower risk of it getting worse. And get this, for certain colorectal cancer patients, their survival rates almost doubled.
Okay, let's break this down because hazard ratio sounds super clinical, right? But what it means is incredible. A hazard ratio of 0.25, that's a 75% relative drop in risk. Let me say that again, a 75% reduction. I mean, wow. It is a number that just makes you sit up and go, okay, what is going on here?
So, the data is really compelling, no doubt. But the million-dollar question is, how? How in the world is a cholesterol drug doing all of this? Let's get into the science.
So here's one of the biggest clues. Researchers call it the responder effect. It turns out the anti-cancer benefits seem to be the strongest in people who are responders. That's just a fancy way of saying their cholesterol levels dropped like a rock after they started the statin. This is a huge hint that the drug's main job, lowering cholesterol, is somehow tied to its cancer-fighting abilities.
And this next part is just fascinating, especially when we talk about stopping cancer from spreading. Think of it like this. Cancer cells are sneaky. They grab onto these little things in our blood called platelets and use them as a disguise, like an invisibility cloak, to travel around the body. Well, it seems statins make those platelets less sticky, so they basically rip off the cancer cell's invisibility cloak, making it way harder for it to sneak off and start a new tumor somewhere else.
And this isn't just some cool theory. Look at the numbers for prostate cancer. You see a nearly 50%, actually a 48% lower rate of the cancer spreading in people who use statins. This chart says it all. By messing up that travel plan, statins could be playing a massive role in keeping cancer locked down.
Okay, so if you thought that was interesting, the story is about to take another turn. Because the very first statin didn't actually come from a modern pharma lab. Its roots are in something all natural.
Meet red yeast rice, or RYR. This is a dietary supplement that's made by fermenting rice, and it's been used in traditional Chinese medicine for literally centuries to do a lot of things, including, you guessed it, lower cholesterol. And here it is. This is the big reveal. The magic ingredient in red yeast rice is something called monocolin K. And it turns out that monocolin K is chemically, molecularly, 100% identical to the prescription drug lovastatin, which was the very first statin. They're the exact same thing, it's just one's in a supplement, the other's in a pill from the pharmacy. But here's the kicker. The natural version seems to be more powerful. It's more bioavailable, which means your body can absorb it and use it way more efficiently. So much so that studies show that just 3 milligrams of the monocolin K from red yeast rice can pack the same cholesterol-lowering punch as a 10 milligram dose of prescription lovastatin.
Okay, wow. We have covered a ton of ground here. Huge studies, how it all works inside the body, even where this stuff comes from. So let's bring it all home. What's the bottom line here? What does this actually mean for you?
Let's just quickly recap the main points. First, the evidence linking statins to better cancer outcomes is just massive. Second, this seems to work best in responders, the people whose cholesterol really plummets. Third, we've got a cool mechanism, the anti-metastasis shield, that might stop cancer in its tracks. And finally, there's a natural, potent version of this molecule found in red yeast rice.
All right, before we wrap up, I need to pause for a second because this is, without a doubt, the most important thing I'm going to say. Everything we've talked about today, this is for your information. It is not medical advice. Please, please do not make any changes to your treatment based on this. Any decision about any medication, any supplement has to be a conversation you have with your oncologist, period.
So the whole point of this isn't to give you answers, but to give you better questions. The goal is to empower you so you can have a smarter, more informed chat with your medical team. And really, the one big question all of this leaves us with is this. Considering everything we now know, is it time to ask your doctor about the link between your cancer and your cholesterol?